uniform hand hygiene, making sure I cover all my surfaces and that my hands are completely dry. Hello, my name is Shirley. I'll be your CNA and I'm just going to be performing cat care on you. Is that alright? Alright, before we begin, I'm just going to give some privacy by pulling this curtain. Now I'm just going to go to the other side and I'm going to raise the bed to mid-thigh waist level. Alright. Okay, so now leaving a position of comfort and safety with the nurse proctor, I'm just going to go get some comfortably warm water. I'm going to go over here and make sure that the water's warm. Fill that up. Alright. Okay, I'll place that right here. Now I'm just going to be putting this back blanket on you. Now I'm going to make sure that the tag is on the bottom. Alright, so now I'm just going to ask you to hold on to this while I fan fold your covers underneath you to your knees. Now I'm just going to go to the other side. Okay, now I'm just going to pull your bath blanket up. Make sure that you remain covered while I do this. Okay. So now I'm just going to go over here and I'm going to move my table closer to me. Alright, now that my ear is prepared, I can put on my gloves. Okay, so now I'm just going to be going over here and I'm going to lift your gown up. And I'm going to do frog leg. And I'm just going to check for any signs of leakage and make sure that the urine can flow unrestricted. And I'm going to check around the urethra too. Okay, so now I'm just going to go ahead and start. So I'm going to go ahead and grab a washcloth, squeeze the water out of that, grab some soap, lather that up. Now I'm going to be doing a diamond fold. Okay, so now I'm just grabbing around the urethra and I'm just going to do 2 half circles around. So using the clean portion of my washcloth each time. Alright, and I'm just going to move this a little bit closer to me. Now I'm just going to be doing this again. Squeeze out all the water, apply some soap, lather it up. Now doing another diamond fold. I'm going to go over here, but this time grabbing around the catheter. So I'm just going to be going down each side. Make sure to go 3 to 4 inches down. Using a clean portion of the washcloth. Making sure I do a different side each time with a new portion, clean portion of the washcloth. Now I'm just going to do the bottom, making sure I'm grabbing around the catheter. Now I'm just going to be rinsing. So now I'm going to squeeze the water out of that. Now I'm going to be diamond folding. Now I'm going to go down each side, 3 to 4 inches down in one firm stroke. Make sure I do not pull or tug at any time during the procedure. Okay, so now I'm just going to be drying and I'm just going to do this in one motion. So I'm going to be grabbing it around again and I'm just going to go down, making sure I do not go up at any time. And make sure I do not pull or tug at any time. Okay, so now that I'm done with this, I'm going to fix the frog legs, pull the gown back down, pull this out the way. Now I'm just going to be putting my covers back on. Alright, fixing that, and usually I would change my gloves before I do this in the real world. And I'm just going to go ahead and tug down the bath blanket and move that out the way. Pull that over. I'm just going to grab the bath blanket and I'm just going to roll that away from me, away from my uniform. Okay, and I'm just going to go over here and put this in the laundry hamper. Alright, leaving my patient in a position of comfort and safety with the nurse proctor, I'm just going to return my equipment. So I'm going to go over here, put this up. And I'm going to go over here to the commode, open it up. Now I'm going to be rinsing. I'm just going to be drying that. Alright, so now I'm just going to throw that away and put this into its position where it goes. Take off my gloves. Come back. Okay, so so now I'm finished. So I'm just gonna go ahead and lower down your bed. And I'm just gonna fix your bed a little bit while I do this. Are you comfortable? Okay. And I'm just gonna go ahead and give you this call light. If you have any problems or questions, you can press the button and someone will help you. Okay, now I'm just gonna go over here. Open the curtain. Perform hand hygiene. Make sure I cover all my surfaces and that my hands are completely dry.